Is there any published evidence for the impact that pharmacists working in pain services can make?
There is actually rather limited evidence at the moment, which is rather disappointing. And the majority of that evidence largely comes from the States as opposed to the UK or Europe. And I suppose it is like many specialist pharmacy roles that where these roles have developed but have not been formally evaluated as much as we may have liked.
What would you say to a young pharmacist who was wondering whether pain is an area worth specialising in?
I think the first thing that I would say is go and explore, talk to people, perhaps in your local institution, whether that be a hospital or within a GP practice. One of the most rewarding factors that I have gained throughout my time working in pain very much relates to the fact that although the focus of much of my clinical work does revolve around medicines, it requires much more of an holistic approach to the individual and to the patient. So it is, whilst the focus may be medicines, you are needing to use other skills and expertise as well to maximize benefit and have the best outcomes for the individual.
So would you say that this is an area that would suit someone who's got a broader view of healthcare than, say, just pharmacokinetics and pharmacology?
Most definitely, yes. And I think that you can draw upon skills from managing other long-term conditions, particularly in terms of managing chronic pain.
And have you got any advice about where you might start if you've got an interest in pain?
This depends upon your setting, but certainly if you're working in hospital, this may well be an area, particularly in if you're working as a surgical pharmacist and seeing patients in the early post-operative period and working closely with the acute pain service that are available in most trusts in the UK. And if you're working in community or in primary care, having discussions with your colleagues may well be a way in which that you can begin to develop an interest in seeing patients both with acute pain and chronic pain in primary care.
Professor Roger Knaggs, thank you very much for sharing your insights and experiences with us today. You've given us much food for thought. For more information about Professor Knaggs' work, please visit our website using the link in the description, and be sure to sign up for more news, videos and journals. For updates straight to your inbox, please follow the link below, and thanks for watching.